We are delighted to call Dr. Zaigham Rizvi from the Translational Health Science, Faridabad, for the next talk. The talk on inflammatory pathways in chronic pancreatitis.
Thank you, Chair. Good afternoon to everyone. My name is Zaigham Abbas Rizvi, and at the very onset, I would like to thank the organizer for the kind invite, and thank all the preceding speakers actually for really setting up the stage with all the animal models and describing the mechanisms of acute and chronic inflammation. So my talk will basically revolve around inflammatory pathways in chronic pancreatitis and how we utilize some of the already existing literature information and some of the experimental results that we conducted to come up with a immunotherapeutic intervention. So the prevalence of chronic pancreatitis is ever increasing, and especially in a country like India, the number of cases are increasing. And there are a number of underlying etiological causes for pancreatitis, but the underlying basis for chronic pancreatitis remains chronic inflammation, which leads to, over the period, disruption of exocrine and endocrine function. Now, what is already known about the initial triggers of acute pancreatitis is that the initial injury to the acinar cells leads to the trigger, which leads to the premature release of zymogens. It also leads to the CCKR pathway activation, NOD1 pathway activation as well, which leads to further NF-kappa B and IRF activation, leading to recruitment of the antigen-presenting cells, especially macrophages and neutrophils in the nearby vicinity of pancreatic tissues, and thereby contributing to more production of pro-inflammatory environment. These subsequent injury and pro-inflammatory cycles ultimately leads to chronic inflammation, which is mainly mediated by M2 macrophages, which initiates the events of fibrosis. Now, though a lot of innate immune cells are implicated and already known, well documented in literature to play a role in chronic pancreatitis, but the role of adoptive T cells is very poorly characterized. And some of the recently published literature, including the very interesting clinical cohort done at AIIMS, it was shown that the chronic pancreatitis pancreas biopsies, they show persistently high levels of CD4 and also ROR gamma T expression, which is a master transcription regulator for Th17 cells. Now, with this background, the gaps in the fields are really what is the predominant immune response in chronic pancreatitis. It is very less characterized, and if we characterize this predominant immune response, can this information be utilized to develop immunomodulatory therapy for amelioration of chronic pancreatitis? So for this, what we utilize is, as Dr. Monica mentioned in the preceding talk, we utilize three of the well-established animal models for chronic pancreatitis: cereulin-induced, L-arginine-induced, and ethanol-induced chronic pancreatitis. And we use them coupled with a very detailed histopathological assessment to characterize the inflammation and the acinar cell injury, and also carried out immunophenotyping analysis as well as the mRNA biomarker analysis. So this was some of the initial results when we were still developing the animal model for chronic pancreatitis, and we could clearly see that both L-arginine and cereulin causes very high degree of acinar cell injury. There is a very profound edema, and there is huge infiltration of neutrophils that could be seen. There are, obviously other types of cells, such as, we carried out the immunophenotyping through single cell suspension of the pancreatic tissue, and we could found almost 2 to 5-fold increase in the macrophage population and neutrophils, and these macrophages probably the M2 macrophages. We also became interested in understanding how the T cell response is being modulated, because not much literature is available on T cell response. We could see that in the pancreatic tissue there is huge presence of IL-2 secreting, TNF-alpha secreting, IFN-gamma secreting, CD4 positive T cells as well as CD8 positive T cells, and especially there is huge increment in the IL-17 positive T cells, which indicates a possible role for TH17s as well. To dissect it more and understand whether there is really a predominant role of T cell, we use this RAG1 knockout mice, which essentially lacks the T cell and the B cell component. And when you do the flow cytometry, we could clearly see these mice clearly lack both CD4 and CD8 cells. And when these mice were subjected with repeated injections of cerulin, there was significantly reduced attenuated levels of chronic pancreas shrinking that was seen. And we carried out the histopathological assessment, and as you can see clearly, as compared to the wild type mice, the RAG knockout mice have a very attenuated chronic pancreatitis pathology with significantly improved scores of acinar cell injury, inflammation, and fibrosis. With this, we asked if T cells are really playing a role. Can a T cell modulator, particularly a T cell inhibitor, can have ameliorating effect on chronic pancreatitis? So for this we utilize tacrolimus, which is a known inhibitor of calcineurin and T cell activation, and it leads to decrease in the IL-2 production. We subjected this tacrolimus treatment to the 3 well-established model: cerulin, L-arginine, and ethanol, basically mimicking 3 different etiological bases, and we could see clearly from the animal data that there is decrease in the overall protection in the body in terms of body weight loss. There is protection in terms of shrinking of the pancreas, and also the overall score of tacrolimus treated animals showed improved in pancreatitis. Similarly, we also carried out L-arginine induced chronic pancreatitis and gave them treatment with tacrolimus. Again, there is significant protection in terms of atrophy of the pancreas. There is significant protection in terms of the immunopathology of the pancreas from these treatment groups. In the ethanol-induced chronic pancreatitis model, again this was a model which is established by Minopti Apte group, and we followed the ethanol treatment followed by the LPS insert. And we could see again in the case of tacrolimus treatment, there is clear-cut protection. The acinar cells are pretty much intact. There is lesser inflammation in the pancreas and a much improved score. So since a lot of protective effect was seen in case of tacrolimus, and since tacrolimus is already known inhibitor of T cell response, we became interested in characterizing the overall immune profile of the pancreas of the chronic pancreatitis, both in with or without treatment. So what we could see clearly and what was expected is there is suppression in the Th1 response, there is suppression in the Th17 response, and similarly there is IFN-gamma IL-17 suppression in CD8 compartment as well. And We also, carried out some mRNA-based expression profiling for some of the known pro-inflammatory cytokines that are responsible for the pathology of chronic pancreatitis. And we can clearly see there is, more than 2 to 3-fold suppression in the tacrolimus treated group as compared to the chronic pancreatitis. We further went on to characterize the overall fibrosis in these tacrolimus treated mice, and we carried out mice and trichome from the isolated pancreas samples from these mice. And the overall, you can see from these, mice and trichome stain slides that the overall blue, presence of blue color is almost gone in the case of tacrolimus treatment, indicating there is decrease in the fibrosis, which is also confirmed by looking at the mRNA expression of some of the, known fibrotic markers. And we finally also looked at the antioxidative response, since oxidative stress is one of the mediators for the SNR cell injury in chronic pancreatitis, and we looked at some of the important enzymes that mediate this antioxidative response, and most of these are particularly elevated in case of tacrolimus, suggesting that tacrolimus not only suppresses the pro-inflammatory cytokine response through T cell suppression, but also helps in overcoming the oxidative stress. So with this, I summarize that we showed through mice data, both by using wild type as well as rare knockout mice, that indeed T cells are playing a very important role in chronic pancreatitis, and we use tacrolimus to show categorically that the inhibition of T cell response is actually helpful in overcoming the chronic pancreatitis. And the take-home message will be that tacrolimus or similar drugs can be tested in randomized controlled trials for therapies in patients with chronic pancreatitis. With this, I thank my mentors and collaborators and all the funding agencies, and I'll be happy to take up questions. Thank you.
Nice talk. So, did you check any, there's any effect of the tacrolimus on the acinar cells itself, like in the in vitro study?
So that is something that we are now planning to do, because initially the interest was to look at the immune suppression pathways. So now with some of the other suggestions also, we are planning to do a quick check with what it is doing with the acinar cells and even the pancreatic stellate cells. So yeah, so we are planning to do that.
And just a technical question. So in the past we have found that isolating RNA from the pancreas is really difficult because of, I suppose, lots of RNAs, things like that. After you having induced chronic pancreatitis, do you find that you get intact RNA for your subsequent PCR experiments, etc.?
Yes, we do. One of the problems with L-arginine is it messes up with the metabolic metabolism of the animals. So for that, it is very essential to use saline injections as a subsequent dose for L-arginine, or you load the L-arginine with the substantial amount of saline. But no, we have been able to do the mRNA studies using the L-arginine model, and the mRNAs are pretty much intact here.